A surgical drain is a tube that's placed on the inside of the abdomen and it travels to the outside. Its purpose is to drain fluid. They come in a variety of sizes, and you'll probably hear us referencing them as either a JP drain or a Blake drain. And they can have a couple of different purposes. One is diagnostic. It kind of gives us a window into the abdomen and lets us know what's going on by just looking at the fluid that's coming out of the drain. So if there's bleeding, if there's bile, if there's pus from infection or pancreatic fluid, we're able to see that in the JP drain. It's also a treatment. So the treatment for a lot of these things is just to take the fluid away from the area. So we're able to both diagnose and treat with the JP drain. This is the JP drain. This is the part that will be on the inside, this white part here. And then the outside will be some of this tubing and the bulb where the fluid accumulates. There's also a stitch that holds the drain to your body. What's important to note is that it does not drain stool or other bodily collections. It's not an ostomy bag. It just drains abdominal fluid, pus, bile.
So now that you know what a drain is and that you're going to be going home with one, we're going to talk more about drain care after I show you what supplies you're going to get when you're discharged from the hospital and what supplies you need at home. So the first thing I'm going to show you here is this drain. So this drain is the one that you'll be leaving the hospital with. Obviously it will be inside of you, but I wanted to show you there's two different ends that you could have to this drain. One of them is a bulb like this one, and the other one is what we call a gravity bag, which looks like this. And we'll talk more about that. This is a measuring cup, which everybody will get, as well as a syringe. The measuring cup starts at 30 mLs, so anything less than that, we would like you to draw it up with this syringe and empty it so we have an exact measurement of everything that comes out of this drain. Some people will have a stat lock. This is something that secures the drain to your skin. And we use this particularly with tubes that are very, very long, like this one. You could see this tubing is quite long, and we don't ever want your tubing or the bulb to get caught in anything. So what's nice about this is when it's attached to your skin, if the drain gets caught, it actually pulls on this as opposed to your skin. So some people have these. Everyone will also get gauze and some sort of adhesive device. So the gauze will go underneath and over top of the drain. And then you'll either secure it with tape or something we call a tegaderm, which is just a clear plastic cover. We will also be giving you a log for you to catalog everything that comes out of your drain, the output, the color, and the consistency. For showering purposes, if you need something, we can give you this, which is just basically a stretchy material, as you can see here. And you can actually stretch this out all the way, and you can put this over your head and secure your drains to it like a scarf. If you don't have this, or you want to use something that you have at home, such as a shoelace or a scarf, that is also fine. We are also asked that at home, you know that you have soap and water to wash your hands. If you don't, we expect you to have some sort of hand sanitizer, safety pins with which to secure your drains, a set of gloves if you would like them, and then lastly, a thermometer. Now we're going to go over how to care for your drain. The first thing we're going to talk about is stripping your drain and then emptying it. So the first thing you want to do is wash your hands with soap and water. Again, if all you have is hand sanitizer, that is fine. You can put gloves on if you'd like at this point. If not, that is also okay. It's whatever you choose. So the first thing we're going to talk about is this drain. And you can see here, it's already full of fluid. Maybe if I put it up against my scrubs here, you can actually see the fluid. So you can see the bulb is compressed. but nothing is coming out, right? So if this happens, it could be because you have a clot in there or because the fluid is getting kind of thick. So in that case, we're going to talk about stripping. And we actually recommend stripping your drain before you empty it every time, regardless, even if you feel that things are flowing fine. So what you want to do is start at the site closest to your skin. We're going to pretend this is my skin for now. So whatever hand is your non-dominant hand, closest to your skin, and you're going to push all the way down so that you can see here it's completely secured, okay? This is so as you're moving this hand, it does not pull against your skin. That's very important. We don't want to pull the drain out. Okay, so what we're going to do is take this hand, you're going to squish down also just as hard, and you're going to move your hands down the drain. If you can see there, see how flat that tubing gets? That's what we want. You're going to go as far as you can. When you realize, oh, I still have more tubing left, but my hand won't go down anymore, you're going to take this hand off and you're going to put it right behind your new section here. And you're going to do the same thing. Hold down real tight and you're going to keep moving with your dominant hand all the way down. Okay, see, I still have more tubing left. I'm going to do it one more time for you. Move this hand right to the edge and push all the fluid in as much as you can. There you go. And now you can see there is some fluid in there. If you feel like this is really hard on your hands, a neat little trick is actually to use hand sanitizer and just put a little bit on your hands and just work it just on the outside of the tube, just one quick outside of the tube. That way, as you move down, your hand will just slide easier. It's actually a quite easier way to do it. So for anyone that has like any hand discomfort or they feel like they're just not getting good traction, you can try that. So now your drain is stripped and you have fluid in there. So now we have to talk about emptying it. So this is where you need your cup and the syringe that we talked about before. So it's really important when you look at this drain, you see it has this access, which is the part that goes to you, and then it has this little cap right here. This cap you pull off and then you empty this into the cup, okay? Don't ever try to put the syringe in, just empty it all into the cup. If it's not enough to fill up the cup to the 30 ml mark, then you can always use the syringe to pull it out later. The important thing is you don't want to touch any part of the inside of this cap because you don't want to get any germs on there, okay? So what you want to do is, while holding this closed, pop this top off and then take this cup and you're going to put it right here so that way you know exactly where all the fluid is going. It's not going to drip everywhere. And you're going to let all that air flow in and you're going to slowly squish out all the fluid. Okay? When the fluid is done, you're going to put your cup to the side. You're going to squish this bulb closed as far as you can. Again, without touching the top. You're going to take your little cap and put it right back in. Now your bulb is back to suction, which is exactly what we want to do. Okay? Then, at this point, you can see here, there's very little fluid in my drain. So I'm going to actually use the syringe and I'm going to draw it up and push the air out. So my drain only had 3 mLs of fluid today. So then what I will do is put any drainage into the toilet, and then that way you can flush the toilet and you don't have to worry that anything that comes out of your drain will come in contact with anything of yours. And then you're going to wash your hands, and then you're going to take your log that we've given you and you're going to write down the date, the color, the consistency, and the amount of drainage. And that is how you strip and empty your drain. So just like we did before, we're going to empty this drain. This is called a gravity bag drain. The one we had before was called a bulb drain. So if you have the gravity drain, you're going to strip it the exact same way that we did before. The only difference with this is the cap. So pull your drain all the way up. Make sure that all the fluid is at this end of it because you're going to take off this cap. So again, you want to make sure not to touch the inside of the cap at all. And you're just going to pull this off. Okay, if a little bit of fluid splashes out, that's okay. It's normal, you can just wipe it up. That's why it's easier to pull all the drain fluid to this end before and hold your drain upright. Then you're just going to take your cup. You're going to put the end down. Make sure you get all the fluid out of your gravity bag. Put the cap back on. Again, not touching the tip at all. And then you're going to do the exact same thing with your measurement. And again, with this drain, you should always wash your hands before and after. And that's how you empty a gravity bag. So again, first thing you want to do, wash your hands or use hand sanitizer. You're going to have an old dressing on the site, so you want to very carefully remove that dressing, tape and gauze. Do not use scissors to cut. You don't want to accidentally cut your tube, okay? Once you take that off, you can throw that away. Now is the perfect time to shower because your site is open and showering is really good to keep that site nice and clean. So when you shower, you want the soap and water to hit this area. You don't want to scrub it. You just want to let the soap and water flow over it. You never want to let your JP drain hang or dangle. If you do that and there's nothing securing it to your skin, you don't have one of these stat locks, you're going to be in trouble because it's going to pull, it's going to be uncomfortable, and you're at risk for yanking the whole thing out, okay? So we talked a little bit before about things you can use at home. One of them is a shoestring. So what you're going to do before you shower is you're going to put the shoestring over your neck and you're going to use it like a scarf. So anything you have, like if you actually want to use a scarf, a little light scarf, that's fine. A shoestring, that is perfect. And we talked about before having safety pins. So you can see I've already put this safety pin just through this little extra part right here on the drain. That way nothing goes through the drain. You don't ever want to stick the drain because you don't want a hole, okay? You're just going to secure this through. You can see here, now it's hanging freely. I don't have to worry about it. I don't have to hold it. Nothing's hurting me because it's all the weight is on the shoestring. So now when you shower, like I said, you're just going to let all the water and soap rinse off. When you get out, you're just going to pat this area dry. Then you can take off your shoestring. If you have a stat lock on, you don't need to go through all of this because this stat lock is secured to your skin and this drain hangs in here already. So you don't have to worry about that. So once you're out of the shower, I'm going to take this off. Okay. And then this is what your gauze should look like. We call these drain sponges. So you're going to take, you should have 2 in each bag. So you're going to take one and put it underneath and see these are pre-slit. So your drain hangs just like that. Okay? And then you can put one on top. You can, it doesn't matter which way you do it. You can have them both the same way, or you can have one going the other direction. Either is totally fine. Okay, and then you're going to take tape and you're going to secure it to your skin. Just like this. And you can do all 4 corners. That way it's nice and secure. Okay, like we talked about before, having the stat lock. The nice thing about this is that, again, this drain is really long, right? So if I was just walking around, you could see how it could get caught on something. So the nice thing about the stat lock is it has this nifty button here. And the drain sits right in here. And if you have one of these, we'll help put this on before you leave the hospital. And all it does is sit in here. We put some extra tape on it so it fits securely. That way, again, if I bump into something or this gets caught on something, you can see here. See how this part pulls and nothing pulls against my skin. So that's perfect. And then that way, again, if I want to shower, then it just hangs there without pulling on the skin or the site. And then your JP drain, when you're done with it, should always go somewhere. In a pocket, if you have one, that's perfect. Or you still have your safety pin, You can pin it to the underside of any clothing if you don't want anyone to see it, or inside of a jacket, anything like that. And even if you don't have a stat lock, same thing, right? I could slip this very easily into my pocket and walk around with it, and it would be totally safe and it wouldn't be hanging and pulling on me. And that is how you change the dressing on your bolt drain. So we're going to talk about a few other things to do when caring for your drain at home. We talked about the importance of showering and keeping this site nice and clean. So remember, when you go to shower, you always want to take the gauze off. You never want dirty gauze on, and you never want to keep this site damp. It's very important to keep it clean and dry. So anytime you shower, make sure you remove the whole dressing, discard it, go in and let all the water and soap run on the site. And then when you get out, pat it dry and put all new gauze on. Same thing if you find that your JP drain is leaking. Again, you don't want to keep anything wet near this site, so make sure that you take that off and replace your dressing. Also, in terms of sleeping, you can sleep however you feel comfortable. There's no reason to change the way you sleep just because you have a drain in. And then lastly, making sure that your drain is secure at all times. You want to make sure that even if it's in your pocket or attached to something, you don't have a lot of loose tubing that could get caught easily on a door handle or a desk as you walk by. Same thing if you're in a chair. When you are seated, you want to make sure that you watch the drain as you stand so it can't get caught on anything, especially arm rails. And those are the big things to think about when you're caring for your drain at home. Lastly, if you have any questions, please feel free to call us at any time. We have a number that we're going to give you before you leave the hospital. It's a 24/7 number, and we are happy to help you with any of your needs. Thanks.
So we can remove the drain sometimes in the hospital while you're still inpatient if there's no problem going on. If there's no sort of fluid accumulation and the output is low enough, then we can take it out before you even leave. If we need to leave the drain in, we will have you keep track of the fluid output at home and bring in your total daily volumes. And once the fluid is low enough, once the output is low enough, or we get some diagnostic tests back on that fluid that determine it's okay, that's when we would take out the drain. So the drain is removed in our outpatient clinic, and it's a relatively easy process. It takes 3 to 5 seconds. There's no sedation or anesthesia for it. We cut the stitch that's holding the drain to your body, and then we just remove it slowly. We have to prepare the drain first. We take it off suction, and then we just pull the drain out. This is left open. We don't suture it afterward. We just place a gauze and a bandage over it, and usually closes within 3 to 5 days on its own. You should call the clinic if your drain fluid output changes significantly. So if it increases significantly or stops draining, if you develop signs of infection around the drain site, so increased redness, if you have pus that's draining around, if you develop a fever, chills, give us a call. Also, if you start to develop lots of fluid that's leaking around the drain and no fluid is leaking into the drain, you should call us. Or if the drain falls out, if the stitch comes undone or the drain falls out or is hanging out of the body further than you remember, give us a call. Some things to remember when caring for your drain at home. Maybe inform a family member or friend and make sure that they're prepared to help you take care of this drain. Remember to monitor your incision and the drain output. Make sure you keep a good log, an accurate log of when and how many times you are emptying the fluid, and keep those daily total values ready for us. It helps us to determine when the drain can come out. And then just keep us updated with anything having to do with a drain or anything that you may be questioning.